Hi everyone, this is Sam Lau from the Research Center for Environment and Human Health, which was supported by a grant from RGC HK S.A.R. The topic is to declare or not who would choose to self-report the positive COVID-19 results to the health authorities and why. My team members were from Hong Kong Baptist University across the different units. And here is the agenda. Hong Kong is a very small city and also highly urbanized with 7.2 million people. Ever since the pandemic, Hong Kong has been adopting the zero COVID policy in line with the mainland China. Hong Kong has been hit hardest because of the Omicron variant in its fifth wave pandemic. And Hong Kong has been overwhelmed by the substantial community transmission and incapable of isolating people. So the Hong Kong government has introduced a new online system in the face of the substantial transmission of the Omicron variant in early March. So people who test positive of COVID via the RAT, the rapid antigen test, they have to report the results on this online reporting system. And it has been quite effective. In 18 days, about 400,000 people had registered their positive results via this platform. So to declare or not declare, so there has been very little known about the usage pattern of the declaration form by this COVID-19 survivor, and also the reasons of using and not using the declaration platform. So we aim to examine the usage patterns of the survivor on this platform and examine the reasons of using and not using the platform. So in terms of method, which is a cross-sectional study via convenient sampling, the inclusion factor including the COVID-19 survivor age 18 or above living in Hong Kong. So the key finding, number one, 42.6% of the survivors reported that they had used the declaration platform. That means over half of the participants did not use the platform to report their positive results. So the reasons to use the platform were to fulfill the civic responsibilities, to fulfill the requirement of employers, to obtain a certificate of exemption from vaccination. For those who choose not to use the platform to report their positive results, the reasons were afraid of being sent to community isolation facilities, and they thought that they have the self-isolation capacity at home, and they were afraid of being labeled. And the key finding for our study reviewed that female, non-student, full-time employees, married individuals, and elderly were more likely to use the declaration platform to report their positive results. To conclude, our studies contribute to the understanding of the reasons and characteristics of people who choose to declare and not declare their positive results. And also the finding got implication to health authorities regarding the motivating and demotivating factors of the survivor to report their positive results. In terms of the action to take, we got to develop relevant community promotion and education strategies to improve the declaration rate. This is very important because it would help facilitate the local health authorities to build a better and fuller picture of the pandemic situation, so as to translate into control measures in reducing the COVID-19 transmission. Thank you very much.